Hello, Ryan Roberts back with another YouTube video for you today, guys. I've been meaning to get this one up for quite a while, but it's just seems to be never ending with these fucking videos I've got to do. But I've got to keep them going for you guys. This one's going to be on anxiety, so I'm gonna aim to answer a few questions, obviously, about anxiety, as I've suffered with it for a fucking long time, guys, through things that I've seen in my childhood and adulthood, and things that I've witnessed and stuff like that, and things that I've generally witnessed that have been traumatic. Um, What is anxiety? Sorry, anxiety comes in all different categories. You might have like PTSD slash generalized anxiety, which is obviously what I've been diagnosed as having, guys. So then you've got like seasonal, I think it's social anxiety disorder, where you don't like to go out. But generalized anxiety is just a mix of, it covers a wide spectrum, guys, to be honest with you. It covers such a broad spectrum. It includes all of them. But to be honest, if you're looking for a cure for anxiety, right, I'm going to share what I found with you, which is there is no cure for anxiety. Doesn't mean to say you won't get better, because you will, but there's no cure. There are things you can do yourself. Cognitive behavioural therapy, CBT. Pardon me. CBT, enhancement therapy, where you look at your patterns of anxiety and stuff like that. But for a lot of people across the board, guys, that just doesn't seem to work. Um, so what else is there apart from talk and therapies? Well, again, there are different things. Now, just because I'm saying something doesn't work for me, doesn't mean to say you shouldn't try it, because it may do the job for you. There's things like medications, counselling. So apart from talk and therapies, there's medications. Again, antidepressants. So antidepressants are used for depression and anxiety, but for anxiety they don't seem to work. But again, please give them a try before you. There are side effects to any medication you try, which your doctor should warn you of that. I haven't got time to go into all the side effects. So if antidepressants don't work, they may give you something called a benzodiazepine tranquilizer. These are minor tranquilizers, guys, that are addictive and liable to misuse if used in the long term. However, saying that though, I've been on tranquilizers, on diazepam now. So examples of these would be diazepam, lorazepam, that sort of thing. And basically how they work is they just calm you down and relax you and slow your body and brain down. So obviously if you're having a bad anxiety attack and you pop a benzo pill, then you're going to feel it within about 30 to 90 minutes. Again, only severe people should be given them long term, and in smaller doses if possible. And I want to talk about benzodiazepines, and I want to talk about the newer sort of tranquilizer, which is pregabalin, but we'll go on to that later on. So benzodiazepines such as diazepam are usually given in smaller doses for up to 4 weeks. It can be given for. Your doctor's probably giving you much shorter time span than that, to stop you from getting addicted. I've been on them 15 years now, and I'm still not addicted. I'm not saying that that's going to be everyone, because it's not. An awful lot of people will get addicted to them, but they can be given for anxiety, tetanus, muscle spasms during tetanus, static epilepticus, which I'm not quite sure of that, what that means. I think it's like where you constantly have epilepsy. I'm not sure though. Spasticity problems with cerebral palsy. Alcohol withdrawal. I don't know if I've covered that. Drugs withdrawal. So it's not just anxiety, but the main treatment for that, the main use for them, the main contraindications for them are anxiety. If you're going to take any medication, tell your doctor whether you've had an allergic reaction, whether you've lost someone that you love, whether that you have had or have ever had a history of alcohol or drug misuse. That's important because these type of medications that slow the brain down are very addictive, guys. They are very addictive. Make no mistakes about that. But I don't, just because I've said that, I don't want to put you off trying them, because if they're done in a medical setting, you should be fine. But, you know, I'm not... Take this information at your own purpose, because if you do try any of these drugs and you get addicted to them or whatever, you know, there's nothing I can really do about that. I'm just giving you information, so I'm not a doctor. I'm just going off what I know and what I've done myself. Herbal treatments don't tend to work, to be honest. But again, they might work for you. And then obviously there's the new tranquilizer, like sort of drug pregabalin, which in low doses slows your brain down, in high doses speeds your brain up. But if you're looking for a lot of people with anxiety want a buzz, right? Because it's taken them away from that anxiety. And pregabalin is such a nice buzz. I find it a better nice buzz than diazepam. I'm not using it for recreational purposes, although I do get recreational effects from it, because, you know, that's just what happens. So that's just a short video on anxiety, guys. If you are suffering from any type of anxiety, reach out to me. Or like, comment, subscribe and share. We want to help as many people as we can. So thanks very much.